Okay, thanks everyone. I have a great story today. Adeel, Malik, and Bilal Naved created a new tool just in a couple of days to really meet a need they saw out there. So, guys, talk about what you saw in the marketplace that you thought you could work on.
Yeah, sounds good. Thanks, Vic, for giving us this opportunity to share the story. So basically, what we saw happening, or what kind of the critical need was that we identified, was that, in this time where, one, social distancing is so important, and two, medical resources really need to be allocated as efficiently and effectively as possible, we realized that us being a virtual triage solution at our core, and kind of having expertise in routing people to the right place, have this opportunity to apply our core solution to the specific use case of making sure that patients who really do need to go to the ER for COVID risk factors or just other risk factors are being instructed to go to the ER and given specific instructions on how to go do that. But then also that people who don't need to be accessing, and potentially, at least equally importantly, people who shouldn't be accessing healthcare resources, who definitely don't need to go in physically, maybe can just use a telemedicine visit or don't need care at all, are being given appropriate instructions along those lines as well. So, freeing up, nurse call center and even telemedicine bandwidth in times when telemedicine utilization has spiked like we've never seen before, and that people who really need care are going in and accessing care, right? So really, it's our same core principles of care routing, getting people to the right care at the right time. Now there's just this hyper acute focus on it because the consequences are so dramatic of people not going to the right place.
Talk about your background or the company's background. I mean, why did y'all think you could do this? I mean, there are a lot of people trying to think through this.
Sure. Yeah, I'll let Bilal kind of touch on that.
Yeah, Adeel and I, along with our two co-founders, Dave and Peter, have a history and track record of, thinking about problems that matter to us and figuring out ways to bring together the right people and resources to solve them. And then we had done that for a few years before starting ClearStep. So, ClearStep's inspiration came initially from some parallel experiences that Adeel and I had. I had, at that time, this was a few years ago, just started medical school at Northwestern University. And as soon as we start, friends and family start asking you, what do I do for my sore throat? What do I do for my tummy ache or my hurt toe, right? And I'm thinking, well, let me get back to you in a few months when I learn about those units. But why? But really the question that struck me was like, why are they calling me? Aren't there all these resources out there? How do people figure out what to do for their symptoms when they're not feeling well? Started doing some research and realized that there's not really great tools. People go to Dr. Google and walk away with more anxiety than clarity. People don't know that there's 24/7 nurse lines on their insurance card, so they resort to calling the trainees in their family. And I was, telling Adeel about this problem, and he noted that, this small problem of individual patients not being able to know where they should go for care or access that care easily actually amounts to a huge systemic issue that he had noticed in his sort of world working with digital health industry.
Yeah, and that issue is pre-COVID-19, when
right.
The old, it's only 2 months ago, but it feels like 20 years ago. Yeah.
Yeah, right. So I told Adeel about it, and he said, well, there's a huge opportunity here. He was working at the time at Accenture doing life sciences analytics consulting, and was sort of one of the youngest consultants working with global MDs on projects of relevance to digital health, doing the full strategy for large partners, large clients, and saw, the advantages of larger organizations and the resources they have, but also the lack of agility that is made up for by the startup world. And we, joined forces, and he started focusing on what is the problem really at the system level. I'll let him talk a little bit about that.
Yeah, no, I think Bilal touched on it well, right? It's really two main things: missed opportunities by health systems or healthcare providers to actually deliver the right care at the right time. This is, a $50 billion missed opportunity to deliver care at the right time. And then there's also this the flip side of the coin from the payer side of just wasted spend, right? Unnecessary ER visits, unnecessary acute care visits that could be handled telemedically. So the same solution of optimizing care routing and optimizing access to care, making ClearSteps or making creating channels for ClearSteps to care affects all sides of the industry. And we saw this opportunity to create a care routing solution that can actually, appeal to both. And we recruited two of our close friends, Dave, who, spent 10 years working at, Mozilla, Dropbox, to be our CTO, and then Peter to become our head of design, chief marketing officer, leveraging his experience at Twitter doing, marketing and design to really focus on the user engagement and user experience of our platform, recognizing, like Bilal said, that there really aren't clear user experiences for people to go to access this information. And that's really what we're trying to do, deliver information for next steps as crisply and clearly as we possibly can for care.
Yeah, so how does it work for COVID? So I mean, I've checked it out, but I'm not sure the audience has. So it is a
Sure.
anyone with SMS texting on their mobile phone can interact with it. Is that right? Is that fair?
Yeah, that's right. So anyone can go to ClearStep.health, and there they can access either the core symptom checker, which can address any one of 500 chief complaints just about, or the COVID specific screener. That one, the experience feels the same, where on your phone, it's web optimized. You can start answering questions related to your symptoms, your other conditions. And what we did is we took that expertise we'd been developing over the past 2 years to do triage and focused it on COVID. And that expertise allowed us to understand what are the best sources for guidelines. What are the primary sources that are trusted across the entire landscape? And then how can we take that and merge that with the guidelines the CDC is coming out with? And the CDC was really focused on guidelines as they pertain to which symptoms are indicative of COVID risk. But at the same time, they didn't go so far as to say that these symptoms could also mean a whole bunch of other problems that may not be related to COVID, and they didn't answer how do you address those. And that wasn't their job. They were focused on here's the warning signs for COVID. And what we did is we fused in our expertise and the protocols we have to make sure that our system, if you put in I have a fever and a cough, was also asking questions while at the same time gauging for COVID risk, making sure there wasn't something else serious going on that you may still need care for, and ensuring that broad safety net.
Yeah. Okay. And what's been the response?
Yeah, I mean, so we, after creating this, went through a 9-day sales cycle with a major health system in Florida. Launched
That's
it.
incredible. So people will complain about a 9-year sales cycle. 9 days is probably a record.
It was unreal, absolutely unreal. And a lot of kudos to our partners there, because they were clearly seeing a high priority to make sure their patients and people, in Florida and their geography had access to ClearSteps for care, right? And so they moved really quickly. We still had to go through the same hurdles, right? Compliance review, legal review. It was just high on the priority list, so it got through really quickly. And literally, 9 days later, after starting the conversation, it was live on their site. And then an email marketing campaign launched a few days afterwards. And, within a week, I think by like day 7 or 8, it was over 100,000 utilizations with them, really, or perhaps overall with the ClearStep tool, but still like really high growth. And, what was most kind of rewarding was to see the actual user feedback from this. Like, we were seeing the broad data, right? That okay, a lot of people are using this, but I actually, have in front of me, we have a feedback tool at the very end where people can just like write in and submit feedback. And, a couple comments, worthy of note, thank you. I found this really helpful. It put my mind to ease knowing what symptoms you're looking for. May God bless you so that you can in turn protect us. And another one, thank you for doing the screening. It really does relieve anxiety. Peace be with you. So we were seeing dozens.
People are scared. I mean, and there's also this, I don't know, it's some kind of psychological thing where if you see all this scary stuff on TV and you hear things, all of a sudden you start feeling sick yourself. And like, I don't know, maybe I have something. And so having an objective tool that you can interact with, either gets you care quickly or it relieves
Yeah.
anxiety, or both.
Yeah.
Yeah.
Exactly. And
Right.
by far the most common triage recommendation was, hey, you're fine. You just need to practice some social distancing.
Right.
Right. So, yeah.
Yeah. And from the hospital's point of view, there would have been, those 100,000 people would have been calling or trying to go in there or
Exactly.
interact with them.
Exactly.
And that's one, that's not safe. And two, it's really inefficient for the hospital.
Exactly.
Right.
Yeah.
Yeah.
Or stressing themselves out.
Yeah. And so give me a sense of like where you think this could go. Like what's the vision for the future for ClearSteps?
Yeah, you know, the overarching vision for ClearStep is making sure that we are, in an easy way, providing people the clearest and most useful, best next steps for care. And, you know, symptom checking, and we do this in a sort of messaging first or symptom checking first way, because, you know, similar to, you know, I would say like intercom, the idea is that we want to make what can otherwise be thought of as complicated information as easy as possible, as easy as it is to talk to your doctor from the comfort and convenience of your home. And what that means is asking, you know, a few questions at a 6th grade reading level, allowing people to answer those. And then the whole experience, you know, leads in from there, making sure that you are finding providers that are in your network, can book that care, can shop around between different options, and bringing the sorts of experiences that we all have come to expect from the industries of shopping, transportation, shopping with Amazon, transportation with Uber, et cetera, to healthcare, and prevent anyone from ever having to call their trainees in the family to ask what to do for their sore throats.
Yeah.
We all can't take care of every single person, you know, that we care about. There's too many of them. So through solutions like this, we can.
Yeah. Okay. Well, thanks, guys. Keep going. It's great to have your tool out there helping folks. Where can people look for it if they want to get more information?
ClearStep.health. Just visit our site. If you're interested in learning more, shoot us a note via our contact us form. We'll get back to you that same day. Yeah, ClearStep.health.
Okay, ClearStep.health. Thanks, guys. Really appreciate it. It's fun to talk through.
Thanks, Vic.
Okay.
Thank you, Vic.
Appreciate it.
Bye.